Okay.
All right. So, welcome everybody. It's me, Dr. Nima, and I'm here with Dr. Ben Tehrani, who's a podiatrist, and we both work together out of my office and surgical center. How you
Hello.
doing, Ben?
I'm good, man. How are you?
I'm great. I'm great. We were discussing because we're also friends about like what we can do to help educate people during this stage of the coronavirus pandemic, and I know there's some questions coming up, so we decided we'd kind of go over a couple of like questions that people might have or things that they're wondering about.
Talk
Um,
about the N95 mask. We know that right now they're a topic of a great discussion, and we've noticed, Dr. Nima and I, that a lot of even working professionals that are using it are not using it to the point where it's actually effective. And Dr. Nima, can you kind of explain why?
yeah, everybody's kind of going out and trying to find these N95 masks because that's what they hear, but really, when we were learning how to use these N95 masks, it was almost like a 2-hour certification course because you can't just put this on. Both Ben and I, because we have beards, the N95 mask would not create as the effective seal that it needs, and really would not be effective at preventing us from getting infected. So, if we were have to go to the hospital or something, we would definitely have to shave so that the mask can form a seal. These masks are a little bit different. I have one right here, but they have like usually two elastic bands, and on the inside, they have seals that are supposed to press up against your skin on the sides as well too. And what that's meant to do is block as much air as possible from going around the mask, and so that all the air has to go through the mask. And when you wear one of these things, you really have to feel for our healthcare workers because it is really difficult to breathe through one of these. And within like 15 to 20 minutes, your nose is already starting to get red. It's hot in there. And that doesn't even count all the other PPE that they're wearing. So please, save these masks for our healthcare workers. I just happen to have one lying around because I'm a healthcare worker, just in case I can get it.
Show the thing about the bands because I've seen people they double band across their neck area, and that's not the actual way to wear it.
Yeah. So you basically, one band goes like above your ear. Mhm.
Exactly.
And like right now, I can already feel, you got to form a tight seal here. And again, it's not sealed because I can feel it kind of coming around a little bit like this. But when you don't have it sealed, the air can get in and infect you.
Yeah,
Uh,
the problem is the top band. If that's not secured against the top part of the backside of your head, you will have a vent open, and that's clearly going to allow the viral cells to come in if you're in that vicinity of the virus.
yeah, the moral of the story is if you haven't been trained to wear an N95 mask, save them for other people.
There's a
Close by.
shave challenge going around too. I mean, I did it last week, and then I realized I'm actually not going to work, so I don't
I
really.
did, yeah. I did it too, almost like 2 weeks ago, and my wife hated it. So,
The beard is back.
uh,
What's your take on the recommendations from the CDC to wear cloth masks? What do you think about that?
yeah. So, masks in general. So there's also an ear loop mask, which is disposable, worn in the hospital. Won't protect you against N95 because it can sneak in. And the same thing with cloth masks. Again, you have to know how to properly use the mask, meaning like, once you've used it, don't leave it laying around because you can, if you're infected, you can infect like the countertop you left on or the floor. It's got to go straight into the washing machine. But masks in general do not protect you. What they do is if you are infected, they'll prevent the spread of infection to somebody else. So if everybody were to wear a mask, then it reduces the transmission of the virus because the virus kind of hits this wall, which is the cloth mask, and it can't shoot out 6 feet when you're not wearing a mask. So they're
I think
mostly to prevent spread.
I think
Yeah.
it's what was interesting to me is that Anthony Fauci, who's the head of the National Institute of Allergy and Infectious Disease, he came out, I think it was 2 days ago, and he said that he says he thinks there may be actually 50% of the population that's infected that will never have symptoms, period, because the
Mm-hmm.
body's innate immune response takes care of it, and you actually don't have any symptoms. And that's alarming, and that's why I think it's important for people to at least whatever you have at home to be able to use to prevent you from infecting others in case you fall into that 50%. Now, whether we know it's true or not, we don't know. But I think it's important that at least we have those guidelines set in place to prevent that from actually infecting other people.
Yeah, the crazy thing about this virus is that it affects different people in different ways. And although there are some comorbidities, which are, like hypertension or lung disease and, obesity, other things, there's some that we just don't know about. There's some people who are otherwise healthy, and it might be like a genetic predisposition to this virus. So, you can't really trust anybody because it can be an asymptomatic illness in a lot of people. You're absolutely correct.
What do you think about like if someone like a loved one in your home gets sick from coronavirus? Like there were guidelines from CDC. Want to go over like what they recommend doing?
Yeah, actually, this kind of came up because I had a patient who, had a sick individual in their house, and they're asking for some advice. And so if you go on, I would definitely recommend going to the CDC website and also checking in with the doctor who's taking care of you or your family members, because information changes so quickly. But
Right.
in general, what you need to do is isolate that person to their own room. If they have their own bathroom, that's even better. And anytime, they should wear a mask anytime like you go to interact with them. After you interact with them, you should definitely wash your hands for 20 seconds. You should wipe down like all the light switches, the door handles, the knobs, anything that could be touched where the virus can live. I would open up the window, or if you have an air purifier, to help kind of just get the air a little bit more clean and fresh. Um, and
Those
you
are
have to monitor their symptoms. Like the other thing is the emotional and physical care that you have to do for these people. Like if they start having some shortness of breath and their fever, and people can deteriorate pretty quickly. Have a very low threshold for taking them to the hospital, especially if they're looking like trouble breathing.
it's I think it's important to, especially if they do have comorbidities, to monitor them fairly regularly. If they're diabetics, to be checking their blood sugars, and it's very difficult. Like I heard a story about like a 37-year-old guy who was sleeping like in a different room, and his wife tragically woke up, and he was actually passed away overnight. So it shows you the importance of constantly being in communication, check in, once every hour or so, see how they're feeling, see how they're doing. Um, that's excellent.
Yeah, and then emotionally, you got to be there for you. This is a very lonely disease. Like people in the hospital. If you go to the hospital, you can't really have visitors. When you're in a house, like you can't have your normal human interaction. So, even if it's FaceTiming through the door or writing notes or things like that. I mean, I think that goes a long way because emotionally, if people feel like they have a need to be alive, I think they end up fighting harder and recovering quicker from their illness.
And that's why I think the role of Zoom has played such a critical role. No, like the
Yeah.
fact that like we're able to connect with our friends and families. Um, that power of being united is very it's wonderful. I mean, I keep kept in touch with my cousins in New York, and I hardly got to talk to them over the past couple of years, and now we're in this together. And I think that's important for our audiences to understand that you're not alone. Even if you're feeling depressed, there's ways to combat that, to be able to help yourself get through this, because I don't think it's over the next month or so. We're going through this at least for the next 30 to 60 days.
Yeah, if you look at other countries, I wouldn't be surprised if we're still out like I mean, obviously all of April, but probably most of May too. So we'll see.
Yeah. So, okay, great. Well, thank you so much, man. This was awesome.
Well, my pleasure, Ben. Thanks for
Yeah.
having me, and I hope everybody learned something.
Yeah. Thank you so much, guys. See you.